thank you so much for having me here. Thank you so much for the patient involvement that you've had throughout this conference. It is so greatly appreciated. I like to say I'm not a doctor, but as you saw, I play one on TV. And as a doctor, and as my real life role of a healing patient, I want you to know that patient experience is key to improving our healthcare system. One of the things, and I'm sure you've heard of, the crossing the quality chasm, and one of the sentences in there says, between the healthcare that we have and the healthcare that we could have lies not a gap, but a chasm. And what I'd like you to think about is, if you want to know where the cracks in your system are, if you want to know where there's a gap in your process, if you want to know where is the quality chasm in your facility, in your organization, ask the person who's in the crack. Talk to the person who's trying to get out of the chasm, because we can tell you, and we'd love to share with you. 2 million patients a year contract hospital-acquired infections, and I'm one of the lucky ones, because over 100,000 of those patients die. That's a lot of people. If you look at the populations of those cities, that's how many people a year contract hospital-acquired infections, which are by and large preventable. And what I'd like you to also think about is the new face of patient harm. I'm not obese. I'm not elderly. I didn't live a sedentary lifestyle. Diabetes does not run in my family. I'm a non-smoker. English is my first language. So I went into the hospital for a routine procedure. And there are more and more patients going in for elective procedures, for cosmetic surgery, for elective things, and they don't have underlying comorbidities. I was someone who prepared for my surgery. I trained the same way I did for the LA Marathon. And yet my 2-day hospital stay for fibroid removal, 2 small fibroids, turned into 2 months, a month in the ICU, 6 additional surgeries, almost having this left leg amputated. I have nerve damage in my groin, and this leg goes numb whenever it feels like it. A year and 2 months of twice-a-day home health care nurses, 3 years of going to a wound care center, every Friday having a silver nitrate burn across my abdomen, and then we switched to every Wednesday having the top of my newly granulated skin evened off with a scalpel. 3 years of physical therapy, off and on, having to stop and start because I would get holes across the new skin if I walked too much, if I bent down, if I lifted something. I'd get in the shower that evening and I'd have Swiss cheese going across my abdomen. And 5 months of everyday hyperbaric oxygen chamber treatments at UCLA. That was the only thing after 3 years that stopped the drainage from my abdomen. I couldn't even leave my house for a long period of time because the drainage would start to seep through my padding, which I still wear. And then it would seep through the bibbed overalls that I had to wear because I couldn't have anything around my waist. So it greatly changed my life. Even now, I'm in physical therapy, in pelvic floor rehabilitation therapy. I've had no less than 3 doctor's appointments a week, every week for the last 5 years. I'm missing a doctor's appointment today. I missed physical therapy on Tuesday to be here. So the effects last well after a patient leaves the hospital. I went in, as I said, for a routine fibroid removal. And I had a wonderful team of nurses, as you see, and everything was going great. And my nurses were free to communicate with me. There was no problem. But something started to change. I left the operating room with a fever. And they said, that's not, unusual after a surgery. But then I began to have chills and fevers and nausea and vomiting. I just could not stop vomiting. And they said, well, that's probably from the anesthesia. But then I was in horrendous pain. And so I began to swell. And my doctor kept saying, it's no big deal, you're fine, we're gonna just monitor you. And long about the third day, I got up, the CNA got me up to go to the restroom, and I felt something. And I thought, okay, well, I have a catheter, so I don't need to go to the restroom. And she said, no, we took your catheter out. And so we looked, and my external vagina was hanging down about 4 inches. I was so swollen, and the fluid was trying every means to get out. So my doctor came, and he said, this is what we're going to do. We're going to open just about 2 inches of your incision to help let some of that drainage out, and that should take care of that. And as you can see in that photo, he opened up just about 2 inches of my incision that day. And so he said, we'll keep a check on you, and the next morning he came back, and there wasn't really much drainage. And he said, that's unusual, but don't worry, things are fine, it's no big deal. Well, it was a big deal because I was getting progressively worse and worse. And that evening, the doctor did not come back for my dressing change. A traveler nurse came in to do the dressing change. And she looked at my stomach and she went to put the gauze back down, and my mother said, wait a minute, there's something on her stomach. And the nurse said, oh no, that's lint. And she wiped off my stomach, and my mom said, don't touch that. We don't know what that is. That's not on her, that's in her skin. It was just a tiny black dot, the size, as if you took a Sharpie marker and just did a gentle dot. And my mother said, we need to get the doctor back here right away because we don't know what that is. And that wasn't there at 10 o'clock this morning when the nurse did the dressing check. And so after some negotiating with the nurse, who insisted that she didn't want to bother the doctor for what was going to turn out to be nothing, my mother said, fine, I'll call the doctor myself. So it took the doctor about an hour and a half to get back to the hospital. And when he got back to the hospital, that tiny black dot had turned into a quarter-sized pustule. When he took that gauze off of my stomach, and I was looking up at him and his face, he went white as a sheet. He was terrified. And then I became terrified. And he started calling for the nurse, the same nurse who said it was nothing. And she never returned. And so he looked at my mother and he said, Mrs. Cole, are you squeamish? And my mother said, no. And he said, good, because I need you. And he had my mother to put on gloves. And he went to the windowsill where he had placed the tray of 4x4 fluffs and the things that he had used the day before to open me up. And he took the tray out of the windowsill and he set it across my swollen thighs. And he showed my mother how to hold my abdomen steady. And he pulled a scalpel out of his pocket, took it out of the plastic, and began to cut my incision open. He cut it open, and he asked my mom, he said, now I need you to mirror what I do, Miss Cole, and I want you to put your hands in and we're gonna pull open. And my mother and the doctor, as I laid there, pulled my incision open and my abdomen. And my mother held it steady while the doctor started to take the open box of 4x4 fluffs and stick it inside me, and then he and my mother just started pressing and squeezing out pus and drainage and fluid. And my mother stood there with her hands cupped as he would pull the soiled bandages out of my abdomen and hand them to her. And this went on, and finally the nurse came and my mother went out in the hallway to tell my dad what had just happened. And as you can see, even during one of the dressing changes after that, if you look in the red circle, there's a cut on one of the nurse's arms. She put her own life in danger. My infection continued to spread over the next few days. I watched as my abdomen rotted in front of me. I could smell the dead flesh as it just ate away at me. And all the while, monitoring, and still no big deal. And as you can see, I just started to decay. Sepsis. They were treating me for MRSA, VRE, C. diff, and necrotizing fasciitis. And those wonderful nurses and my doctors who had been very, very open and transparent, the wall of secrecy began to go up. No one would answer my parents' questions. No one would talk to them. We could not get answers. And those wonderful nurses I told you about, well, thank God for nurses. And one thing that we need to do is to start valuing every member of the healthcare team. My nurses knew what I had long before the doctors. One of my nurses came into the room prior to the doctor cutting me open, and she closed the door and she pulled the drape and she pulled my parents to the right side of my bed and she said, "I need to talk to you, but I have to talk to you in confidence because I could lose my job. Your daughter needs help and she needs it quick. And I'm the low person on the totem pole. No one has to listen to me. But if the family requests a consultation with an infectious disease specialist, they have to get you one. And you need to do that immediately. Your daughter's life is at stake." We have to have an integrated system. We can't operate in silos. Every member of the team is important, from the housekeeping staff on up to the administration. And that's why stories like mine and other patients are important, because we can bring home the message that everyone is vital. Another one of my nurses came out to my father in the hallway, and she had a piece of paper rolled up. And she came up to my father and she began shoving this in his pocket, and she said, "Mr. Cole, does your wife still have that black purse?" And he said, "Yes." And she said, "I want you to put this in your wife's purse. I want you to take that purse home. Do not open that paper. Do not read it in this hospital. Do not discuss it after you read it. That is what your daughter has." And that is how my parents found out I had necrotizing fasciitis. So I like to say I'm a survivor of a broken system. There were good people along the way in my health care, and there are still fabulous doctors who take care of me now, who are open and transparent, and who use electronic health records. And so when I have a problem now and I go to the doctor, all my information is there so they can take care of me. So we don't want to have a culture of secrecy. We want openness and transparency, because closed systems, closed cultures lead to bad outcomes. But I want to tell you, we can learn. As you said, don't let a good crisis go to waste. And it's the truth. Wouldn't it be a shame if all of this happened to me and there were no improvements? That would be the real tragedy. This is me after the second of 6 operations. This is what that room should have looked like. Contact isolation, gloves, gowns, masks. You saw one of the nurses didn't even have gloves on. I had several multi-drug resistant infections that could have wiped out my parents, could have wiped out the nurses, the patients in the next room. We have to learn from this. And there are so many people willing to share their stories in a positive way, in a good way, to help better the system. We need a culture of safety that starts at the top. We need to engage our board members so that they understand the importance of what you need to get your job done. We need administrators who understand what's happening on the floors, and if the policies and procedures are realistic for those on the ward to implement, and the department heads to be the support to the rest of the team. I want you to learn from my experience and take it as an opportunity to go back to your states, to your hospitals, your facilities, your agencies, and look for ways that you can improve the system. I want you to invite your boards to become a part and a partner of your patient safety culture. Patient stories and the patient experience humanize the statistics. It puts a face on the stories. It puts a face and it illustrates the harm and the damage and the lasting effects of a broken system, or a system that's not well financed, or healthcare providers that aren't well supported. Telling a patient story and inviting a patient and their family to be a part of your improvement process can strengthen your facility, strengthen your organizations. And just to remember that we are customers, and we want you to see our face so that you take ownership of the outcomes of our care. Patients want to share their stories. We want to protect others. And we want to be a part of the solution. I want to say thank you so much to the leadership of CMS for inviting me here. My story is not a pretty one. There are so many other stories they could have chosen. Nicer stories, stories with a better outcome. You know, people say, oh my God, this is horrible that it happened to you. But my story is a victory story. I'm here, and I am helping in every way I can to be a part of the solution so this doesn't happen to anybody else or their family. Thank you to CMS, because having me here with my story in particular shows that you really are willing to look at the ugly side of things, and you really are sincerely trying to make a change and improve the system and hear all of the stories. I thank you so much from the bottom of my heart. My family thanks you. And on behalf of patients and survivors everywhere, I salute you. And let's go to work.